my name is McKaylee Williams, and today I'll be presenting my proposed community-centered reentry model, which focuses on improving juvenile recidivism outcomes through structured community involvement treatment programs. This project was completed as part of my graduate studies in the criminal justice program at Tiffin University. Overview of current treatment methods. Juvenile recidivism remains a persistent challenge in the United States. This suggests that the current custodial measures may be failing. Juvenile offending impacts both youth and their communities. Research suggests treatment-based approaches may be more effective than punishment. According to Gigante, community-based alternatives result in lower recidivism, yielding long-term savings from reduced reliance on detention. Current role of community involvement. Restorative justice models promote accountability. A study conducted by Shem Tov found that participating in a restorative justice conference program resulted in fewer rearrests upon completion of the program. Some of the services offered in community-based treatment programs include mental health treatment services, substance abuse services, health and wellness assistance, and employment programs. Why change is necessary. Detention may hinder positive development, according to Barnert. Community programs are not as widely utilized as methods for punishment in comparison to custodial measures. Unequal access to treatment services limit their effectiveness. Gigante found that Black and brown individuals had disproportionately less access to treatment options when compared to their white counterparts. Introduction to the proposed model. My proposed model is a community-centered reentry model. It would utilize a structured system integrating restorative justice methods, coordinated access to treatment services, and equitable diversion strategies to ensure equal access to treatment programs. This model is meant to build upon existing treatment programs, not to replace them. The main focus is for rehabilitation. Sustainable funding strategy. Reallocation of detention funding towards community-based treatment programs can provide programs with the support that they need. In the long term, this works out to be an investment. Prevention and rehabilitation measures lead to reduced incarceration reliance. Projected expected outcomes. The immediate outcomes we would expect to see are increased diversion from detention, ease of access to treatment increased, and higher youth participation rates in community-based programs. In the long term, we would expect to see lower long-term reoffending rates, improved behavior for juveniles who complete the program, and a wider employment of more cost-effective justice programs such as community treatment. Overall, we would hope to see a reduction in juvenile recidivism rates, stronger connections between juveniles, their families, and the communities they reside in, and improved access to treatment services. Feasibility and stakeholders. Is this program feasible? Yes, it is. It builds on existing programs and is supported widely by evidence and research. The stakeholders involved include the justice system, who divert juveniles into the community-based programs, schools, who reintegrate the children back into their communities and can provide early intervention as well, and community programs which provide treatment, and families who provide support systems. In conclusion, juvenile recidivism requires solutions that focus on rehabilitation rather than punishment. Community-based treatment addresses underlying causes of juvenile offending. Currently existing programs can be effective with the addition of coordinated services. A community-centered reentry model can promote rehabilitation while still ensuring public safety. Prevention and treatment are both cost-effective measures that provide long-term positive outcomes. This slide contains the references used for my project. And thank you for taking the time to view my presentation.